All right. All right. So today we're going to be talking about intramuscular injections. We're going to talk about some of the ways to give them, some of the muscles you use, some of the benefits of giving intramuscular injections, some of the medications, and then we're going to finish it off with actually going over how to do the skill. So IM injections are administered into the muscle in various places. It has a faster absorption rate than subcutaneous because you get the needle so deep into the muscle. There's more blood vessels there. They're able to pass through the muscle and get the medication into the bloodstream, so it's a lot quicker. So some of the medications commonly administered intramuscularly are Epi 1 to 1000. We learned about that, had it beat into our head in EMT school. That in the mid thigh, hold it down. That's where you'll find the EpiPen. You also have things like Cordal for pain, ketamine, Haldol, Versed. So those are behavioral medications that you can use to help control a combative patient. There's a safe way about restraining the patient and holding them down in a safe manner. You can get the IM medication in very quickly, let it work very quickly because it's in there deep into those blood vessels, and get your patient safely restrained so you can safely transport them to the hospital, figure out what's going on. Another couple things depending on where you're at, where you're working. You have antibiotics. If you're in a hospital setting as an EMT or a medic, depending on what the skill set is for you there, you can give antibiotics, immunizations. You may see that if you went on like a SMAT deployment or something like that, or a clinic that the medical director for your agency put up and you were doing flu shots to help out with the health department or something like that. Then you have steroids. You can give those in most of your respiratory calls. And all these medications you can give IM a little slower than IV, of course, but if you have a tough time, they're a combative psych, they're a small child that's hard to hold down, you don't have enough hands to get an IV, it's a lot safer route for you to be able to get the medication on board to help your patient. All right, there are three main IM medication sites. The deltoid is the upper shoulder. It's the most common site. You can give up to 2 milliliters of medication in that. You have the vastus lateralis mid thigh. So that's going to be your epi spot that we all have learned throughout EMT school, moving on to paramedic school. And it's preferred for 18 months to 3 years old because it's usually a meatier area there and won't hurt the child as bad as, say, the deltoid would, where it's maybe not got as quite as much meat up there and cause a lot of pain. And you have the gluteal muscle of the buttocks. This is best for the larger volume medication. You get above that 2 ml mark, 3 mLs, or antibiotics. Antibiotics have a lot of burn in them when you're pushing those. Some of them are mixed with lidocaine to actually help that. So getting the buttocks there with the medication helps with the burning, the pain that the patient feels, and has a better outcome for them. Also, the gluteal muscle should not be used for children under 3. All right. Moving on to the items you'll need to do your IM injection. So you'll have a safety needle. This just has a protective little cap that goes over the needle. You can quickly cover and protect yourself or the patient from getting stuck again. You have alcohol preps, band-aids, and your syringe. All right, so to perform an IM injection, so you're going to make sure the most important thing is to have all of your materials ready to go before you're ready to start the IM injection. So you need to have that needle, syringe, your medication. You verified your 5 rights on the medication, and then you're going to draw up your medication for administration. So you're going to find the right site. So you're going to look at the age of the patient, what kind of medication you're using. So we'll say that this patient's in pain, you can't get an IV, you want to do something for them. So you're going to give Toradol. So they're an adult patient, we'll go with their deltoid. Common site, it's not going to be more than 2 mLs. So you're going to take your alcohol prep pad next. You are going to go to the muscle, put it in the center, and then start moving it in a circular motion, starting in the middle and working your way outwards. Once you've cleaned it, you let it fully dry. You grab it with your fingers and spread the skin. You insert the needle at a 90-degree angle. Once your needle's in, you're going to pull back on your syringe and aspirate for blood. Make sure you haven't hit a vein, a blood vessel, anything like that. If you see no blood, you're going to go ahead and in a controlled fashion, you're just going to push in and inject the medication. Once you pull your needle out, a lot of people commonly have the Band-Aid like taped to their gloved hand to get it on there and make sure that none of that medication spills or pushes back out. Once you're done with your injection, you're going to remove the needle, get the safety cap closed, get it immediately into a sharps container to prevent you or the patient from getting stuck again unnecessarily. You're going to cover the site with a Band-Aid, and then importantly, stay with that patient, monitor the patient's condition. You want to see the desired effects. If you're giving pain medicine, you wait a little while, you make sure the patient is not in any pain or that their pain has subsided. If they're a behavioral patient, you want to make sure that you're getting that calm, control, they're coming down where you can handle them safely, get them to the right hospital, monitor their respiratory drive, because a lot of those medications have those effects. Then you also want to look for the adverse effects. Did the medication you give them actually be something that they're allergic to, and now you have to do something else? So just monitor the patient's condition for desired and adverse effects. All right, in review. So IM injection is a great way to get medication in quickly for a variety of things. If you cannot get an IV and you still need to get that medication into that patient and it is in your protocol to deliver IM, it's readily available due to how deep the needle gets into the muscle, it gets into the blood vessels, and it works quicker than, say, intranasal or subcutaneous, things like that. The three muscles that are most commonly involved, your deltoid, upper shoulder, remember no more than 2 mLs in that. You have your vastus lateralis or your mid-thigh. That is the most common for the 18-month to 3-year-old range due to how much tissue they have there. It shouldn't hurt as bad. And you have your gluteal muscle or the buttocks. That's where you're going to get where you're over 2 mLs. You're going to deliver a lot of medication, or you're using antibiotics, things that are painful as they're going in that more padded area of the body. But remember not to use that on children younger than 3. And finally, just reviewing the procedure, you prep your equipment, make sure that you've got your right patient, you've got the right medication, you verify your rights, you've got your Band-Aid, you've got your needle syringe ready to go, you found the appropriate site for your patient, you've cleansed it, you aspirate for blood, inject your medicine, you cover with a Band-Aid, and then always make sure to stay with the patient, reassess them for the desired effects and the adverse effects. That's all. Thank you for listening to my presentation on how to do an IM injection. I hope you learned something from this that you can use out there in the field. Thank you.